Despite efforts to improve prenatal care access, the country's maternal mortality rate remains high at 119 deaths per 100,000 births. Limited healthcare resources and uneven service quality are cited as key barriers. Margot Brews from Momentum Health joins us in studio to discuss practical steps to address gaps in maternal support systems. Good evening to you, Margot. Thank you very much for joining us here on Newsnight.
You're so welcome. Thanks, Abigail.
My absolute pleasure. February was Pregnancy Awareness Month. I'm surprised to hear that because I didn't hear a lot of conversation around the topic. Things were very, very quiet, and I think a lot of people underestimate just how dangerous pregnancy actually is. Do you think there's enough conversation and education going around?
I certainly don't. I think you're absolutely right. I think the focus in February is often on Valentine's Day.
True.
And then,
very true.
Yeah, and then everything else that's going on around the world has kind of distracted us from a really important topic.
Yeah.
So I honestly don't think that there's enough education and focus on maternal health and specifically healthy pregnancies.
Yeah.
And it's such an important aspect of making sure that we set South Africans up for success going forward.
Yeah. Let's talk about the maternal mortality rate. I've mentioned now in our intro that it stands currently at 119 deaths per 100,000 births. When you look at it in that perspective, it may not sound a lot to some people, but I think one death is one too many. Let's talk about the statistics and what's causing us to have these high rates.
Yeah, so you're absolutely right. You took the words right out of my mouth. We've seen an interesting trend in the mortality statistics around our mums, and that they were coming down quite nicely. And then during COVID, because of a lack of access to healthcare, really, the mortality rate increased. It is coming down, but we're a long way from the Sustainable Development Goals of 70 per 100,000 lives. So.
And what were we doing right pre-COVID that we couldn't sustain during COVID?
A lot of it has to do with access to healthcare services and making sure that moms present at the antenatal clinics as early on as possible during their pregnancies, so that we can detect risks early and then manage patients. So that's a big part of it.
Yeah, let's talk about prenatal care and why it is so important. We have a huge issue of teenage pregnancies in our country. It's a concerning statistic, but unfortunately that is our reality. And so often there's a certain stigma associated with teenage pregnancies that perhaps stops young girls from going to seek medical care and medical attention. How do we firstly break those stigmas, and how do we ensure that the education is getting to the right person?
Yeah, so it's really important that that girls and pregnant moms present really early on in their pregnancies. You know, the woman goes through such a transformative experience, so her body changes dramatically during the 9 months of pregnancy. And so the earlier we can get people to antenatal care, the better. And a lot of it has to do with sexual and reproductive health education that needs to start really early on.
Sure.
And then creating a supportive environment around girls, because I think you're absolutely right. Many young teenage girls who fall pregnant want to keep it a secret.
Yeah.
And the longer you keep it a secret, the more at risk you are. Not only for yourself, but also your unborn.
And how early would you say should you book that first appointment after finding out? Should it be an immediate consultation?
So certainly, as soon as you're aware that you might be pregnant, presenting to your antenatal clinic or just your local clinic would be really important, because from there you kind of create a really good foundation for the rest of the pregnancy.
Okay, let's talk about maternal health and how we're doing in South Africa. It's no secret that our public healthcare facilities are overstretched, underserviced. How are we doing in South Africa, and where do we need to improve when it comes to maternal health care?
You know, we've got some of the most incredible guidelines. So there's been a massive effort by the Department of Health to create this beautiful integrated framework for treatment guidelines for maternal, perinatal and neonatal care. Where we're falling down is in fact in the execution of those guidelines. So a lot of it has got to do with poor staffing, and then people who are attending to the mums not implementing the guidelines as intended. It's also got to do with a lack of medication sometimes, just poor facilities, and honestly, our healthcare workers really do struggle sometimes with the poor equipment that they have to really deliver the care that they know they need to do. So it's a combination of all of those things.
And let's just talk about the type of support that a pregnant woman needs. A lot of South Africans often go through that journey, unfortunately, on their own, by themselves, without a supportive partner, and that is unfortunate, but that is unfortunately the reality of some South African women. Let's talk about the support that is required to sustain the 9 months of pregnancy and the time after as well.
Exactly. So, I mean, they talk about the first 1,000 days of a child's life as being the most formative, and that really starts in the womb from conception. So if you think about that, that's really the first 3 years. And if you can really set a baby up and a child up for success, they really grow into adulthood in a great way. So in terms of support structures, it really is around making sure that your friends and family are aware and that they can support you, and that you can tap into community services. And in particular, sort of services around mental health support, not only direct care for yourself and your unborn child, but also just support during the pregnancy. You go through like an enormous transformation, as I mentioned earlier, both physical, emotional, and mental. So it's important that all of those aspects are taken care of. So if you're not in a firm relationship, then reach out to those that are closest to you.
Yeah, let's talk about the mental aspect that comes and implications that comes with pregnancy. Very often we hear women talking about postpartum depression. A lot of us who aren't mothers can't relate because I don't think we can comprehend and understand exactly what that means. But let's talk about postpartum depression and why some women are hesitant to speak out and seek help.
It's not only postpartum, it's also peripartum, so during pregnancy as well. And as much as 10 to 20% of women actually will experience feelings of anxiety and depression. So the sooner you can make your healthcare worker aware of that, the more we can kind of put you in contact with supportive structures. So again, it comes back to the stigma, it comes back to your emotions and your hormones are kind of going up and down. And so it's almost a case of not knowing what's normal and what's not normal. And so at the moment you feel kind of really tearful, really anxious, share that with your healthcare workers and the people around you.
And that was going to be my next question, Margot, because like you said, it's a huge life change. There's changes to your life, there's changes to you as a person, your personality, but how do you then gauge that, listen, something might be wrong because everything's changed. Your life is completely different. So how do you gauge that to say, maybe I need some sort of assistance, maybe things are a little bit worse than they should be in this sort of situation? What are some red flags that moms should be looking out for?
So I think the first thing is kind of to educate yourself around what is normal. Because when you know what to expect, then you can kind of gauge whether you're kind of tracking against what's normal. Even though every pregnancy and delivery is kind of unique in itself, just understanding what to expect by what milestone kind of sets you up for success. Chatting to other moms as well, just to kind of hear what they went through, what they experienced. There's a lot of unknowns, particularly if it's your first pregnancy. And so the more you can educate yourself on what to expect, the sooner you can kind of work out whether things are tracking as expected.
100%. Margot, thank you very much for taking time to come and chat to us. I had hoped that we would have done this interview in February, but isn't time just flying by?
It's flying by.
I can't believe it's March already. Thank you very much
Thank you for sharing.
for your time. My absolute pleasure. That was Margot Brews from Momentum Health talking to us about February was Pregnancy Awareness Month and just the importance